this year, we've known that we needed to add additional staff to cover for the increased call volume. We continue to see an increase year over year for our EMS calls. Our staff, obviously, staff an ambulance. They also assist fighting fire. They do that from the ambulance as well. But the EMS calls continue to go up every year. And it was really critical that we add another ambulance this year. Our Board of Supervisors have been incredibly supportive of the county administrator. And so we were able to get that done. So we'll be adding an additional staff medic unit on each shift. We work across 4 shifts. And so we anticipate that going live sometime probably around September, October. And we're super excited. The 13th position, that'll be 12, we'll put in operation. The 13th position will be part of our new pharmacy. All EMS agencies across the state are dealing with the same thing. We're working through new pharmacy regulations. And so we had to change the way we've done that to go to internal pharmacy systems. So we'll be providing our own pharmacy, our own medications, and doing what we call our drug box system for our ambulances. And so when we do that 6,000 times a year, that's a lot of work. And so we've added an additional position. There'll be the division manager of support services. And probably about 60% of their job, if not more, will be focusing on the pharmacy, the medication, and making sure that the paperwork is done correctly for that. What we call a regional drug box system, where the pharmacy is handled through the hospital. You use medications, the hospital restocks the drug boxes, gives you a new medication box to put back on your ambulance. And unfortunately, the way that's been done, because of regulations, we're going to have to change that and do that internally. Not only do we have to worry about the calls coming out, but the calls coming out in a specific geographic location. So if we know we have a lot of calls in our lower end of the county, the Madison Heights community, that's where a lot of the population is. But if we're having to pull an ambulance from Peddler or even the Amherst station to cover that call, that increases call response times. And a lot of times, all 3 of our ambulances are already tied up on other calls, delaying that even further, waiting on an ambulance to clear up, or relying on mutual aid from one of our mutual aid partners. There is no doubt this budget this year, every year, I think our budget saves lives. But I am completely confident that these changes will save lives, and probably many of them, and improve the quality of life for our citizens and those who visit Amherst County.